Erythromycin, clarithromycin, azithromycin, and erythromycin are examples of macrolides drugs. Comparisons of macrolides and adverse effects depends on drug-to-drug interactions, cholestatic jaundice, gastrointestinal upset, and use in dental prophylaxis. In erythromycin, gastrointestinal upset is significant owing to stimulations of motilin receptor. There are more drug-to-drug interactions. Cholestatic jaundice usually seen only with estolate form, and it is not used in dental prophylaxis. There is less gastrointestinal upset and drug-to-drug interactions in clarithromycin. No cholestatic jaundice, and it is used in dental prophylaxis. There is also less gastrointestinal upset and much less drug-to-drug interactions in azithromycin and erythromycin. No cholestatic jaundice for both drugs. Azithromycin is used in dental prophylaxis, while erythromycin is not used in dental prophylaxis. Sensitive organisms for macrolide antibiotics are: number 1, Legionella pneumophila. Number 2, Mycoplasma pneumonia. Number 3, Chlamydia pneumonia. Number 4, Streptococci and some other gram-positive cocci and some gram-negative cocci. Number 5, Helicobacter pylori. Number 6, Mycobacterium avium. Clarithromycin and azithromycin are more potent than erythromycin and are more effective against these two sensitive organisms. Representative drugs of tetracyclines are doxycycline and minocycline. Tetracyclines are broad-spectrum drugs, and the various sensitive organisms are: number 1, various Rickettsia species. Number 2, Mycoplasma pneumonia. Number 3, Helicobacter pylori. Number 5, Borrelia burgdorferi, or what we call as Lyme disease. Number 6, Escherichia coli. Number 7, bacteria associated with refractory and localized aggressive periodontitis. And number 8, bacteria associated with acne. Clindamycin is a bacteriostatic protein synthesis inhibitor, a lincosamide narrow-spectrum antibiotic. There are 5 sensitive organisms, and these are: number 1, Streptococcus pneumonia. Number 2, viridans streptococci. Number 3, Streptococcus pyogenes. Number 4, Staphylococcus aureus. And this is not methicillin-resistant Staphylococci. And number 5, oral bacteroides and some other oral anaerobes. There are 5 uses of clindamycin, and these are: number 1, infections caused by several anaerobic rods and cocci. Number 2, some streptococcal and a few staphylococcal infections. Number 3, oral infections. Number 4, osteomyelitis. And number 5, dental prophylaxis. Metronidazole is an antimicrobial spectrum, and the bacteria is limited to anaerobes and parasitic infections. There are 3 sensitive organisms and indications, and these are: number 1, Bacteroides. Number 2, fusobacterium nucleatum. And number 3, Clostridium difficile. Contraindications of metronidazole are pregnancy, alcohol use, disulfiram use, central nervous system disorder, renal disorder, cirrhosis of liver, and patient taking anticoagulant therapy. Vancomycin is for gram-positive aerobes and anaerobes, a narrow spectrum given intravenously. There are 4 sensitive organisms and indications, and these are: number 1, Staphylococcus aureus, including methicillin-resistant Staphylococci. Number 2, Streptococci. Number 3, Enterococci. And number 4, Clostridium difficile.